Welcome back to the Deep Dive. Today, we're going to tackle a question we got from a listener, and it's super interesting.
Yeah.
It's all about how voluntary Islamic fasting could, impact someone who's living with arrhythmia.
Oh, okay.
So for anyone who, maybe isn't familiar,
Yeah.
arrhythmia is basically like any problem with your heart's rhythm. Could be beating too fast, too slow, or just kind of like all over the place. And our listener, they're dealing with atrial fibrillation specifically, AFib as it's called.
Right.
That's where like the top chambers of the heart, these sort of quiver instead of having a strong beat. So we dug into some excerpts from Sion's show, and it dives deep into this whole fasting and arrhythmia connection.
Very relevant, yeah.
Our mission today is to really figure out, could fasting be beneficial for someone with AFib? Or is it actually risky?
Yeah, what's so fascinating about this topic is that it brings together a spiritual practice like fasting with, these very real concerns about heart health. So exploring this for someone managing AFib, it's there are a lot of layers there.
Yeah, it's a real puzzle, right?
Mm.
So let's start unpacking it. Okay, so the source highlights a couple of ways fasting might actually be good for the heart.
Okay.
It mentions improved metabolic health,
Right.
like how fasting could make your body more sensitive to insulin.
Okay.
That's the hormone that helps regulate blood sugar.
Right.
And it also mentions reducing inflammation throughout the body.
Right.
Both those things sound like wins for your heart.
Absolutely, yeah. Imagine creating a more stable environment for your heart, for it to just do its job properly.
Like that.
The source even mentions the potential for fasting to reduce oxidative stress.
Okay, now oxidative stress, that sounds kind of complicated. Break that down for me.
Sure. Think of oxidative stress like tiny little rust spots that build up in your body, including in your heart.
Oh, okay.
And by reducing those, fasting might help keep, the heart's electrical system running smoothly.
Oh, so it's like a cleanup crew for your heart. I like that analogy.
Oh, yeah.
Okay, the source also talks about weight management as a potential benefit. And I can definitely see how, taking some pressure off your heart by losing weight, that could be a good thing, right?
Yeah, absolutely. It makes sense if you think about it. Carrying extra weight can really strain your whole cardiovascular system. And that strain can increase your risk for all sorts of heart problems, including arrhythmias.
Okay, that makes sense.
So if fasting helps, even shed a few pounds,
Right.
that could really have a ripple effect on overall heart health.
Gotcha. But what about AFib specifically? Does it say anything about fasting directly affecting that type of arrhythmia?
It does. Actually, it suggests that fasting might reduce the risk of AFib episodes.
Oh, wow.
Yeah, and it gets even more interesting. The source talks about research showing how fasting might actually reduce inflammation in the heart's electrical pathways.
Okay, so what does that mean, practically?
Well, when those pathways are inflamed, they're more likely to, misfire, trigger those chaotic signals that we experience as AFib.
Oh, so by calming the inflammation, fasting could, in theory, make those pathways less jumpy.
Exactly.
Less prone to AFib. Wow, that's really promising.
It is.
But I hate to be a downer here, but I'm guessing there's another side to this. What about the risks?
You're right. We can't just look at the positives.
Yeah.
There are potential risks to consider, and electrolytes are a big one, especially when you're fasting and have a heart condition.
See, now electrolytes, I got to be honest, I'm always a little confused about what they are and why would fasting even impact them? It seems counterintuitive to me.
I know, it can be confusing, but think of electrolytes like these tiny little electrical sparks that keep your heart rhythm going.
Okay.
We're talking about things like potassium, magnesium, sodium.
Right.
When you fast, your body can lose some of those sparks, through sweat, urine, just normal processes.
Huh.
And if your electrolyte levels get out of whack,
Yeah.
it can definitely mess with your heart's rhythm.
Oh, okay. So if someone with AFib is already dealing with kind of wonky heart rhythms to begin with, messing with their electrolytes on top of that is probably not a good idea.
Yeah, that's a good way to put it. It's about minimizing additional stress on a system that's already a bit vulnerable,
Yeah, right. Okay, so electrolytes. Check. What other risks does the source mention?
Well, dehydration is a big one, especially if you're fasting for longer periods or you're in a hot climate. When you're dehydrated, your blood volume drops and your heart has to work harder to pump blood throughout your body.
Oh, okay.
And that extra strain can lead to palpitations or even trigger a full-blown AFib episode.
And I'm guessing that's even more likely to happen if your heart's rhythm is already kind of temperamental, like with AFib?
Exactly.
Okay. Anything else we should be watching out for?
Yeah, the source also talks about blood sugar fluctuations, particularly hypoglycemia. That's when your blood sugar drops too low.
Okay.
This can be really stressful on the heart and potentially trigger arrhythmias as well. It's something to be especially careful about during extended fasts.
Got it.
Especially if you have a history of, like, blood sugar issues already.
Right, so we've got electrolytes, dehydration, blood sugar, all things to keep in mind.
Yeah.
Anything else?
One more important point. The source brings up the potential challenge of, like, managing medications while fasting.
Yeah. Medication.
If you're taking medication for AFib,
Right.
it's crucial to talk to your doctor
Yeah.
before making any changes to your eating routine.
Your doctor is really going to be your best guide in this whole process. They can look at your individual risks, maybe adjust your medication schedule. Just make sure you're approaching fasting as safely as possible.
Exactly.
I imagine that's especially important with heart medications.
Yes.
Which often need to be taken on a very specific schedule, right?
Absolutely. Consistency is key with a lot of heart medications.
Right.
And fasting can disrupt that consistency, which could lead to complications.
Yeah, so that open conversation with your doctor.
Yeah.
It's really non-negotiable if you're thinking about fasting and you're managing AFib.
It's so important.
Okay, so we've covered some pretty important ground here, benefits, risks. What does all this mean for our listener who's dealing with AFib, and wants to participate in voluntary Islamic fasting? Like, what's the takeaway?
The biggest takeaway is that fasting with AFib, it's not a decision to make lightly.
Right.
You really have to approach it thoughtfully. Put your health first. And as we've said, that conversation with your doctor, it's absolutely essential.
It's all about finding that balance.
Yeah.
Between honoring your faith and taking care of your physical well-being.
Exactly.
And we're just getting started. When we come back in part 2, we're going to delve into some specific guidelines, advice from the source material to help make fasting as safe as possible for someone living with AFib.
I'm looking forward to it.
Me too. It's going to be good. See you then.
Welcome back. So we talked about the potential benefits and risks of fasting for someone with AFib. But I'm really curious to get into, the practical stuff. What does the source actually suggest for making this whole experience as safe as possible?
Well, as we already mentioned, the first and most important step is talking to your doctor. They can look at your individual situation, medical history, medications you're taking,
right,
and give you truly personalized advice.
But let's say, the doctor gives the green light. What are some practical tips, tangible things that our listener can do to make fasting a bit easier and safer for someone with AFib?
Well, one of the biggest things the source emphasizes is hydration.
Right.
I know we already touched on dehydration as a risk.
Yeah.
But it's worth really diving into, what staying hydrated actually looks like.
Exactly. It's easy to just say, stay hydrated.
Yeah.
But what does that actually mean? Practically, when you're not eating or drinking for a good chunk of the day. Right. The source suggests really focusing on fluids during your non-fasting hours.
Okay.
So between iftar and suhoor, make sure you're drinking plenty of water.
Right.
But it's not just about chugging water. You can also get a lot of hydration from foods.
Oh, that's interesting. So which foods, what are we talking about?
Well, think about things like soups,
okay,
fruits and vegetables with high water content, like watermelon or cucumber, and even yogurt.
Oh, okay.
Incorporating those into your suhoor and iftar meals can really help.
So it's like a two-pronged approach.
Yeah.
Fluids and food.
Exactly.
Makes sense. Okay, what about the actual food we're eating? Does the source say anything about specific dietary recommendations for someone with AFib who's fasting?
It does. Remember we were talking about electrolytes before? The ones that are crucial for that steady heart rhythm.
Right, the little sparks.
Yeah. The source really stresses eating foods rich in potassium and magnesium.
Okay, give me some examples. What are some go-to foods packed with those electrolytes?
Well, bananas and dates are fantastic sources of potassium.
Okay.
Leafy greens like spinach and kale are excellent as well. And for magnesium, you can't go wrong with almonds,
right,
cashews, or even dark chocolate.
Ooh, dark chocolate. Now that's a recommendation I can get behind.
Yeah, a little treat.
But in moderation, of course. I guess it's not just about what we should be eating,
right,
but also what we should try to, limit.
Exactly. The source advises cutting back on things like salt, sugar, caffeine, especially during the non-fasting hours.
Okay.
Those can actually contribute to dehydration and put extra stress on your heart.
Gotcha.
And for someone with AFib, we want to avoid that extra stress.
Totally. So it's about making smart choices and really being mindful of, what you're putting in your body. What about easing into fasting? I imagine like jumping right into a prolonged fast could be tough, especially for someone with a heart condition.
You're absolutely right.
Yeah.
The source encourages people new to fasting or those with health concerns to start slowly. Maybe try shorter fasts at first or like fast on alternate days.
Right.
See how your body responds.
So it's all about like really listening to your body, right?
Absolutely.
Our bodies are usually pretty good at telling us when something's not right.
Yeah, they are.
What are some warning signs that our listeners should be aware of? Like what kind of symptoms should be raising red flags?
Well, if you experience dizziness, chest pain, severe palpitations, or even fainting, those are all signs that you need to stop fasting immediately and seek medical attention.
Right.
Don't try to push through it.
Safety first.
Yeah. Always better to err on the side of caution.
For sure. Okay, so we've got hydration, nutrition, listening to your body. Is there anything else?
There's one more really important tip I want to highlight. Prioritize suhoor.
Yes. The pre-dawn meal. I have to admit, I used to be terrible about skipping suhoor.
Yeah, I know a lot of people are.
But once I realized how much it helped me manage my energy, like throughout the day, I became a total convert. Why is suhoor so important, especially for someone with AFib?
It's all about setting yourself up for success.
Okay.
Eating a balanced suhoor meal helps stabilize your blood sugar levels and gives you a steady source of energy that you draw on throughout the day.
Right.
This is especially crucial for someone with AFib because, as we've discussed, blood sugar fluctuations can trigger those irregular heartbeats.
So yeah, don't skip suhoor, folks. It's not just about the food. It's about like setting your body up for a smoother fasting experience.
Yeah, exactly.
Now, we talked earlier about talking to your doctor, especially if you're taking medication for AFib. Does the source offer any advice on like managing medications while fasting?
It does. It suggests working with your doctor to synchronize your medication schedule with your fasting hours. So this might involve adjusting the timing of your doses or maybe even switching to a different formulation of the medication that's more compatible with fasting.
So it sounds like there might be some flexibility there, but again,
Yeah.
it's a conversation you absolutely need to have with your doctor.
Absolutely.
They're the expert on your specific medications
Exactly.
and how they might be affected by fasting.
It's a partnership.
Well, we've covered a lot of practical advice, but before we move on, I think it's important to touch on like the spiritual side of Islamic fasting.
Yeah.
Especially in the context of our source material,
Right.
We've been focusing a lot on the physical aspects, but we can't forget that fasting at its core is an act of worship.
Absolutely. It's about deepening your connection with God, practicing self-discipline, and cultivating empathy for those less fortunate.
Exactly.
It's a multifaceted practice.
And I think it's important to acknowledge that. Like, some people might feel a certain pressure to fast, even if they have health concerns,
Yeah.
I understand.
So does Islam prioritize fasting at all costs, even if it could potentially harm someone's health?
Not at all. The source is very clear that Islam prioritizes health and well-being.
Okay.
There's actually a beautiful verse in the Quran, Surah An-Nisa 4.29. It states, "And do not kill yourselves or one another. Indeed, Allah is to you ever merciful."
Okay.
This verse is often interpreted to mean that preserving life and health comes before any ritual obligation.
That's so reassuring to hear.
It is.
So someone with AFib, if they're concerned about the risks of fasting, they don't have to feel, guilty or pressured.
Right.
They can still participate in other acts of worship
Absolutely.
and fulfill their spiritual obligations in ways that don't compromise their health.
Exactly. There are always alternatives.
Yeah.
Like giving charity, volunteering, or simply spending more time in prayer or reflection.
I love that.
Yeah.
It's about recognizing that, there's no one-size-fits-all approach to faith.
Right.
Our spiritual practices should complement our health.
Not come at the expense of it.
I agree.
Okay. So we've covered a lot of ground in this part. Practical tips, spiritual considerations. Anything else major from the source material that we haven't touched on yet?
I think we've hit all the key points.
Okay.
We talked about potential benefits and risks, provided practical guidelines,
Right.
and of course, emphasized talking to a doctor and prioritizing your health. We even explored the spiritual aspect.
Yeah.
and that flexibility within Islam to accommodate individual health needs.
I think our listener is well equipped now to have an informed conversation with their doctor and, really make the best decision for their individual situation.
I think so too. This is a great foundation.
But before we send them off, let's wrap things up with some final thoughts to ponder. Okay, so we've really journeyed through this whole topic.
We have.
The potential benefits, the risks of voluntary Islamic fasting for someone living with AFib. And we've given you guys, the practical tips, spiritual reminders. And the most important thing, talk to your doctor.
Absolutely.
But before we let you go, I'm kind of curious, what are you thinking about as we wrap up this deep dive? What's sticking with you?
What's really hitting me is how this whole conversation highlights the need for, more personalized advice.
Okay.
We've been talking about AFib kind of generally.
Right.
But it's not one size fits all. There are different types, different severities, and those nuances could really impact how someone responds to fasting.
So a blanket statement about fasting and AFib, it's not really enough.
No, not really. We need to go deeper.
Okay.
Imagine a future where, research allows us to give truly tailored recommendations based on the specific type of AFib someone has.
I like that.
We could, pinpoint which types might benefit from fasting and which ones, really need to avoid it.
That would be amazing.
Wouldn't it?
To have that kind of personalized guidance,
Right.
it would take out so much of the guesswork.
Exactly. We could say, okay, if you have this type of AFib,
Yeah.
fasting might actually help reduce your risk of complications. But here are the specific things you need to watch out for.
Oh.
Or, on the flip side, with your type of AFib, it's too risky. And here are some alternative ways to fulfill your spiritual obligations, without putting your health at risk.
It'd be like having a roadmap.
Yeah.
For navigating this whole intersection of faith and health.
Exactly.
And it could open up so many possibilities
Yeah.
for people with AFib who, want to participate in this spiritual practice.
Absolutely. I think it's really exciting to think about how, future research might bridge that gap between modern medicine and these, ancient spiritual practices.
I agree. So to our listener out there who's been with us on this journey, we want to leave you with this thought. The conversation about fasting and AFib, it's ongoing.
Yeah, it's evolving.
As research evolves, we're going to have, hopefully even more clarity, more personalized guidance to offer.
Okay.
But in the meantime, remember, knowledge is power. Talk to your doctor, listen to your body, and approach this decision with a balance of faith and wisdom.
Beautifully said.
Thanks for joining us on The Deep Dive. Until next time, keep seeking knowledge and keep those questions coming.
Take care.